all. Today I'll be moderating for a few minutes. Later on, Dr. Dhanesh will join. So for the English session, today is our 994th day of uninterrupted. I just imagine we are just about to reach the 2000th day of our regular meeting. And let us, before starting the sessions, let us have a silent prayer for 1 minute. Thank you very much to you all. And as you know that this IFPH is conducting regular webinar every day, uninterrupted. There is no holiday. Today it's Shivratri, and many people are enjoying, but we are here enjoying the Shivratri. We are praying to the Lord Shiva with our learnings and continued. So this is also the strength of Shiva. And friends, as you know that we start from 7:30 to 8:30 for the Hindi sessions. For today, Dr. Fazal was the guest, and thereafter we have the 8:30 to 9:30 we have the English session, and it is followed by the Malayalam sessions. So let us start the sessions for today. And for today, our speaker is none other than our regular speaker, and who was absent for a few months because of some of the tragedy in the house. And today she is back, and I welcome her, Dr. Sumana Kumari Panda. Madam, I welcome you all in this session. I think I have made you the co-host. Let me introduce Dr. Sumana. She is the retired district medical officer of the homeopathy in Cuttack, and she under the Health and Family Welfare Department of the Government of Orissa. She is the consultant at the Dhabeswar Homeopathy Clinic, Cuttack, and she has a clinical experience of 35 years treating the chronic cases of all types, and especially the obs and gynae, palliative cares and cancer cares. And she has teaching experiences of 18 years in the Department of Metra Medica at Avinchand Homeopathic Medical College and Hospital. She has worked as a research principal investigator in collaborative research project under CCRH government, efficacy of homeopathic therapeutic and then she was also included for the awareness program of HMO in community organized by the CCRH, and she has presented many scientific papers in the Liga Research Society of India, Andhra Pradesh, Tamil Nadu, and in our session also. Article was also published in IJRH, an international, mostly academic journal, and she has been awarded as the best homeopath COVID warrior by the Marwari Mahila Samaj, and she is the Woman of Inspiration by the Lion Club. So several things are there, and you may be aware that she has been participating in our, she has been attending our seminars regularly, presenting different topics and very beautiful cases she has shared with us. And today she is back with the evidence-based homeopathy. That is the need of the time. And she will be presenting 2 cases of the CARCINOCIN. So friends, let us welcome Dr. Sumana Kumari Panda for her presentations, and I will request Dr. Sumana, Madam, to start your sessions. You are the co-host here, and you can start the sessions now.
Thank you, sir. Namaste.
Yeah. Namaste. Nice to see you, Madam, after a long time.
Thank you, sir. Thank you.
I bless you and hope that you will continue with this and maintain a good
health. Inspiration, sir. Today I am going
definitely.
to speak something. Really, you are behind, and your inspiration will be with me and is with me, and that has given me a great support, sir. Great strength also. Because after my tragedy, really, it was very difficult to recover. You and Dr. Dhanesh and some more, my teachers are my seniors, really, due to all these, due to all of your inspiration, really, till I am able to speak today. Thank you. Thank you.
God bless you with all the courage and confidence so that you can be a better part of the community, society. So you can start your session now, madam.
So good evening, everyone. And today is Mahasivaratri. So happy Mahasivaratri to everyone. And with the will of God, with His blessings, I am going to start my session. And my session today, really for this session, I am very much thankful to my teacher, Dr. Sahani sir, and my friend, Dr. Dhanesh, who has given me great strength, really. So directly coming to the topic, I am sharing my screen.
So now Dr. Dhanesh has joined now, and I welcome Dr. Dhanesh and to take over the charge of the moderator for today.
Thank you, sir. Yes, sir. Dr. SUMANA KUMARI PANDA, madam, we are very happy to see you back in our session.
Thank you, Dr. Dhanesh, for giving me
I have
strength.
already introduced her, and she is about to start the sessions now.
Okay. Thank you, Dr. Dhanesh.
Welcome.
So today my topic is evidence-based homeopathy. And as my teacher told, Dr. Sani told that it is the need of the hour, and I will go through the cases of carcinocin. Today is the part one, you can say. Today I will go for the case and more towards the mathematical part of the carcinocin, and to some extent about the hormonal problems during the case. And I am having another session on 8th March. On that also, I will continue with the carcinocin cases. Okay. So coming to the first case, case 1. On 14th June 2025. This is a very recent case and continuing with me also. Now also she is with me. A lady of 39 years, female, presented for secondary infertility of 1.5 years. Her last childbirth was 5 years before, and after that they took break for 2.5 years, like 3 years like that. And when they tried, the last pregnancy was very eventless, no event was there, and she had a very, of course, cesarean section, but pregnancy was very well, and that was the spontaneous pregnancy. She has not taken any medicine or any hormonal therapy or for induction of the pregnancy. But now when they were trying for 1.5 years, but the lady couldn't conceive. So in that case, they came to us for the secondary infertility. She had menses regular, flow was very normal, no dysmenorrhea, no leukorrhea, no pruritus. So pathological symptoms were very, very less in that case. So she had her menarche in 14 or 15 years, as she said. And what she had a nodular acne on cheeks and occasionally itching. Not many more symptoms she had. On examination, I had seen that no tenderness of abdomen, no breast tenderness, nothing. But she had infertility for 1.5 years. So in that case, I took the case history on the physical generals. So to whom, here I must say that to whom we will say secondary infertility. When we will say that she is not, infertility usually after 35 years, when without any protection, when a couple are mating at least for 6 months and there is no pregnancy, we can term it as infertility after 35 years of age. But here, secondary infertility means they had a girl child. They had a they had a child. They had a child of 5 years, And after giving birth to a baby, 1 or 2 or 3 might be. Secondary infertility means that the lady had pregnancy. That might be the product, might be the baby, the product might be miscarriage, product might be abortion. But she conceived. That is, and after that, when there is a gap, they are mating, the couple are mating without any protection, but they are not conceiving. In that case, we can term it as a secondary infertility. So here they were trying for 1.5 years, but there was no conception. This secondary infertility, approximately 11 to 12% of the couples suffer, and during the period of why that happens, that might be due to reproductive health changes, might be age, and here I think the age is the major factor because the lady was of 39 years old. And hormonal imbalance, PCOD, PCOS, and uterine issues like fallopian tube block, all these things may contribute towards secondary infertility. So coming to my first slide, that this was the case, and physical generals, ambithermic thirst was increased. Nothing, no other parameters were abnormal. And coming to the mental generals. So under mental generals, we find very good symptoms in that case. Okay, the girl is an engineer and working in Tata Consultancy Services, and she has her own business also, paternal business. They are having hotels, they are having the other wholesale counters, so many more types of business. Her husband was looking after them, and she was also very interested, and she was always entering into the business besides her own TCS engineering work. So due to that, she was I asked her, how do you manage? I have marked that she was very fastidious in her work, very particular, a perfectionist in time also, and workaholic, very industrious girl, and very serious about the work. Not always about the other things. She was very serious, but about her work she was very serious. Okay. And another thing I had observed while interacting with the girl, she was very headstrong, and very peculiar thing I had marked during interaction. See, in Odisha, usually the people are very conservative and social customs are very strict. But when I interacted with her, that she is not a girl of 23, 24, she is of 39 years now. But what she told, that she is some interaction, during some interaction I had observed, she didn't told me this, but I had observed that she had a strong logic that the social customs, this and this and this are not right, this has to be changed, so we have to change. Why not? Well, why you are not she was saying someone that why you are not changing this custom, you should change it. Why are you believing in all those things? That's why I listened that, and I written the symptoms that wants to bring changes in social customs and uses her own logic in social customs. She was very anxious about her health, about her business, because she has to be very perfect in those aspects, and she was very careful, high level of commitment, self-loving. She had a very strugglesome life. That's why that strugglesome life throughout, during her study career, during her job career, during her business career. So the struggle made her for the high level of commitment. She is a very committed lady. and but sometimes it is marked also during the health conditions. She is very impatient about the health conditions. Okay. So, and very demanding also. In this case, we can think of arsenic also. But why I went for carcinocin, I will tell you. In past history, she had APD, acid peptic disease. In family history, father was hypertensive and mother diabetes. Nothing more very indicative. But personal history, she is an engineer and personal business. Treatment history, already she had undergone allopathic treatment with a hormone replacement therapy in Apollo Hospital. And after that, when she didn't conceive, then she came to us. Under investigation, what she brought us from Apollo Hospital, that is the anti-Mullerian hormone level was 0.36, which is very, very destructive, very, very low. So the hope is very less in that case. So when she came to me, she was saying that, Madam, if anything can happen, but still then I am very hopeful that something must be happen with homeopathy. So this word also gave me strength that in this condition of AMH 0.36, I must take up the case, and I became very serious about this case. Because beforehand I have seen many infertility cases, and I have presented also in this forum many infertility cases. AMH 1.3 I have seen, AMH even 0.76 I have seen, but that case was my failure. But 1.3 AMH with 1.3, the lady conceived with our treatment, homeopathic treatment. But this case was 0.36. I had never treated such low level AMH cases in infertility. This is my first case, really. 0.36 AMH was. So in that case, this was the report of 4th April 2025, and in June the lady came to us. So seeing this case as a acne with the there might be AMH 0.36, I thought this is a case of psychosyphilitic miasm, more towards syphilis. But as she had taken many more hormone therapies, as she had taken many more treatments, so after that, usually my experience is I go with a dose of Medurinum, and one dose 100 ml fractional. I continued one teaspoonful once daily for 1 month, along with Caligrom 30 once in a week. So the beginning of the treatment I did like this with a nosode, and after that, after 3 months, the patient didn't came to us. After 1 month, the patient came to us after 3 months. Okay. Her LMP was 3rd September 2025. 25th September, she came to us. She came to me. Really, at that time, I was just sitting on my, after a gap of 15-20 days, I was sitting, and at that time she came to me. So this is the report of what the anti-Mullerian hormone 0.36 what she brought to us. And she also brought to us the cholesterol report was normal. She had only LDL level was 113. Nothing, these two reports she brought to us. So after that, why I am saying the AMH is very, very important in this case, that I will go with. Why AMH? What is AMH? What is anti-Mullerian hormone? Let's go to the literature of anti-Mullerian hormone for a little bit. That is the anti-Mullerian hormone is produced by cells within the really during gestational stage in fetus, the anti-Mullerian hormone secretion occurs. In male from 8th week of gestation, in male fetus, the AMH secretes from the Sertoli cells. Okay. And from 23rd weeks of gestation in female fetus, this AMH is secreted from the follicles of the ovary. So, in female, as the lady came to me, she is a female. So, in that case, they are present from birth only, and they contains an immature egg. AMH plays ovary contains immature eggs. AMH plays a vital role in regulating the growth of these follicles. So the number of follicles in a girl in ovary is directly related to the AMH quantity. Okay. So essentially, the hormone serves as a marker of ovarian reserve in quantitative value, not for the qualitative value. How many numbers of follicles are there, that depends upon AMH. But whether the follicle, whether the matured follicle which ruptures, that is able to carry this zygote or not, that is a different thing. AMH is not responsible for the quality, but for the quantity, for the ovarian reserve, AMH is responsible. So AMH indicating the quantity of eggs a woman has laid. However, AMH is a measure of quality of the, not a measure of quality of the eggs, which is also a factor for fertility. Unlike another factor, another thing, a good thing with AMH, that unlike hormones, we see estrogen, the menstrual cycle, the first phase is estrogen cycle, the next 2 weeks is the progesterone cycle. So in the next second 2 weeks after ovulation, the estrogen reduces. Before ovulation, progesterone reduces. But AMH is not like that. AMH level remains relatively stable throughout a woman's cycle, making it an excellent tool for assessing ovarian function at any time during the year. So at any time, for estrogen study, for FSH, for LH, for progesterone study, we have to take the days. We are counting the days when to send this blood sample. But in AMH, there is no calculation for days, because AMH remains constant throughout the cycle, throughout of a woman. Okay, this stability really very reliable indicator than other fertility related hormones. Really, without going so many follicles hormonal study, we may go for the directly for the AMH, so that we can know that whether the ovarian reserve is sufficient to make fertility or not. So that is a very good idea, because the patient will not spend so much of money in the different tests. AMH is in best in that aspect. So this stability allows AMH to serve as a more reliable indicator, especially in which cases, in those cases of irregular cycles. From I will say in the next slide that from the value of AMH, we can assess that whether the lady is going through PCOD or having normal fertility level or very low ovarian reserve. So we can think from the AMH level only. That is a very good indicator. So anti-Mullerian hormone is a peptide belonging to the transforming growth factor beta superfamily and acts exclusively through its receptor type 2. Already these things are discussed, and it really, what happens in this case, AMH plays a critical role in regulating gonadotropin secretion, ovarian tissue responsiveness to pituitary hormones. So FSH LH secretion is also depends upon the AMH. Okay. And the pathogenesis of polycystic ovarian syndrome. What it causes, AMH inhibits the transition from primordial to primary follicles. Okay, and is considered the best marker of ovarian reserve. So that's why it is also AMS significance is also very much very significant role for decision making in IVF, assisted reproductive technologies, IUI, IVF. There also this plays the AMH plays a very the level of AMH plays a very vital role. So what is the relationship AMH to fertility? Already we had discussed that it is very much related to the quantity of the follicles inside the ovary. So what is the ovarian reserve we can know. As a woman age, the ovarian reserve naturally decreases. That we know after age of 35, the ovarian reserve usually decreases. So that's why, but nowadays what happens, what we see in our practice, that most of the girls getting married by 31, 32 like that, and after 30, and after they are taking 2, 3 years, 4 years break like that. And when they are trying to conceive, so sometimes we find it crosses 35 years. But usually 30 to 33 years girls are coming, but after when they suffer from infertility, they are consulting some other gynecologist, and when they came to a homeopathic doctor, usually they find that they are the age is above 35 years, and at that time we find the AMH level is very low. And when the AMH level is low or very low, it becomes very difficult to go for an IVF also. So, so that is a social problem nowadays with every doctor. Okay. Some women with low AMH still have the ability to conceive, while others with a higher AMH level may fail to fertility challenges. So this may happen in some rare cases also. We can't say that very low fertility can't conceive, but the percentage is very, very low. So what is the high AMH we count usually more than 3 nanogram per milliliter. Okay. So up to 4 also nowadays it is counted as the high AMH. Above 4, 1 to 4 usually very high is above 4. So in that case, in this condition, we can think of polycystic ovarian syndrome. So without going for an ultrasound, from AMH value also we will be able to know. Normal AMH is usually 1 to 3 nanogram per ml. Normal AMH levels a healthy ovarian reserve and good position to conceive naturally. Okay. Low AMH. Hello. Hello. Hello.
Yes, madam. Yes, madam.
Am I audible now?
Yes, audible and visible.
Oh, in between the internet connections.
Yes, it's quite common now. Don't worry. You can go ahead.
Okay. So normal AMH is 1 to 3, low AMH is 0.5 to 1, and where with the reduced ovarian reserve and few eggs are available for conception. This low AMH condition also very difficult to conceive. And less than 0.5 is very low AMH, and here what happens, the lady proceeds towards menopause, the climax is towards menopause. So in this condition, it becomes very, very difficult to conceive. And in this case, we find that the lady brought us the report of 0.36. We find here 0.36, which is very, very low AMH. That means she is proceeding towards menopause. The climax is towards climaxes. So in this condition, it was very, very difficult for conception. So I went for, in this condition, as I told you, that with the mental generals and the very low AMH condition, proceeding towards menopause. So in this condition, specifically basing upon the mental symptoms, she was very fastidious, very committed lady, and a very workaholic lady. So in this condition, wants to change the social stigmas. So all those anxious for business. So in this very serious. So in this aspect, I went for carcinocin 10m directly. Okay. So carcinocin 10m 1 dose in 100 ml fractional. I went with 1 teaspoonful once daily, and along with that, I went with the omega-3 fatty acids and alpha-alpha tincture 15 drops BD and pituitary 200 also I continued with once daily. So next, after 1 month, again, 21st October 2025. So the LMP was 2nd October 2025, no conception. But she came with the delayed menses. Because the previous was, I think, third, no, not delayed menses. Not delayed menses. I think I had missed another date in between. Okay. Where she, and she brought me the prolactin level 58.66. See, hyperprolactinemia. And the TSH level was 0.08 on the 6th October 2025. Here is the report. Insulin level is normal 5.62. Testosterone was quite normal also. But prolactin level was 58.66, which is very high. The normal is 2.8 to 29.2. But usually in fertility cases, we see a higher limit as a 20 normal. And here 58.66 and the TSH was 0.08, hyperthyroidism along with the hyperprolactinemia. And as hyperprolactinemia contributes to anovulation, we know, and that also contributes to infertility a lot, causing anovulation. It will not, it affects the FSH and prolactin level, and it causes anovulatory cycles, which again contributes to the infertility. So this is a very difficult condition in that case. So hemoglobin was very normal and fasting insulin normal. But here AMH, she brought me the report of AMH 1.82. 1.82. After carcinocin 10m in September, in October, she brought me the report of AMH 1.82. So that increased 0.36, increased to AMH 1.82. So that made me more inspired, and I went with the treatment of carcinocin 10m. I had not given because due to I usually give a gap of minimum 2 months for 10m potencies, and that's why I didn't repeat it. And pituitary 200 continued, alpha omega-3, and along with, as the TSH was 0.08, thyroidinum 3x BD. In most cases of hyperprolactinemia, AMH problem, as they are, those are hyperprolactinemia, AMH, as they are related to pituitary, I went with the, in my practice, I go with the drug pituitary 200. So thyroidinum 3x, I went with BD. Again in next month, 7/11/2025, the menses delayed. Oh, menses delayed and AMH, she brought me the report of 1.82. So in November, I repeat again this carcinocin 10m 1 dose 100 ml fractional, 1 teaspoonful once daily. Then in 21st November, again 2025, she came to me with the no menses, no conception. Menses, she had menses in 3rd October, but she came to me in 21st November, delayed menses, suppressed menses, but no conception. But she brought me the report of TSH 1.30, thyroid level, the thyroid stimulating hormone increased, and the prolactin level was 11.32. This report also I have, but here all the reports I have with me, and prolactin level in the records are with me. Prolactin level from 58.6 reduced to 11.32. And the TSH from 0.08, it increased to 1.30. Medicine discontinued. Sorry, medicine continued. That same carcinocin 10M, pituitary, alfalfa, thyroidinum 3X, and omega, all continued. Next is 29th December 2025. She came to me with the LMP of 26th November 2025. She had her LMP in 26th November 2025. Her blood, at that time, her blood pressure was 122/79, then 9 millimeter of mercury. Really, in every visit, I had gone through the blood pressure, which was quite normal and a pulse like this, 90 per minute. Weight was 55 kg. She had, in the beginning, she had, in my record, I see, she had 57 kg. 57 kg. In between, she reduced 2 kg. And what she brought me, she told me that, Madam, I had 26th November, but in December, there is no periods. Okay. I thought in 3rd October, she had the periods. Next, she had her menses 26th November. That means that was delayed. That might be due to the prolactin level AI, OM, like that. Anovulatory cycle might be the prolactin level increased like that. But she brought me the Gravindex test report, which was positive. Then I told her that this is a Gravindex test, slide test report might not be positive. We can't conclude that this is pregnancy because AMH was quite low, 0.36 from the beginning, you can mark. Next, after the carcinocin, that was increased to 1.82. So somehow hopeful. Okay. So in that case, I advised her to go for serum beta HCG. Serum beta HCG came to be positive, and that came to be 964.60, which is equivalent to 5 to 7 weeks of pregnancy. As she was 26th November and she approached me on 29th December, so that's why I was unable to, it is not wise to send her for ultrasonography, because in ultrasonography the cardiac activity is usually found after 6 weeks of gestation, and she was only continuing with the 5th week of gestation. So in that time, the cardiac activity may not be visible. So that's why I sent her for beta HCG, and which came to be positive. And she had little bit problem, like she had too much cough, aggravation at night, sleep during, thick greenish yellow sputa, and thirst was reduced. So with this, due to cough was too much, and that's why she was very afraid. With this condition, thirst reduced, thick greenish yellow sputa, And because usually she was thirsty. At the beginning, I had, while taking the case history, we had taken that she was thirsty, but here she is thirstless. So in this case, I had given much more importance to this, and with greenish yellow sputa, this is the beta HCG report. You can mark that the 964.60 beta HCG report, which is equivalent to 5 to 7 weeks of pregnancy. I went with a pulsatilla 201 dose 6 hourly and followed by tuberculinum 200 2 doses once daily. So 1 gram, this is not 1 dose, this is 1 gram. 6 hourly. Followed by, so after when the cough reduced, I told her, you after carcinocin, as in the beginning I had decided that this is a psychosyphilitic case and more dominance towards basing upon the pathology. Basing upon the pathology, I had decided, but carcinocin of basing, I went with the carcinocin, which is also a psychosyphilitic, psora psychosyphilis. All three miasms are covered up under carcinocin, and the mental symptoms are strongly indicating towards the carcinocin. So I went with the carcinocin in higher potency. But after that, as she was repeatedly suffering from cold attacks, and I went with the tuberculinum 200, only 2 doses once daily. So that any congenital anomaly might be with that case, because due to the 39 years of age of the mother, she might had some congenital anomalies with that. So that's why for the prophylactic purpose, I went with the carcinocin I had already given, but as she was suffering from repeated cough and cold and a very severe cough, long continued cough, so that's why I went with the intermittent nosewort, that is the tuberculinum 200 after carcinocin, 2 doses only. So again she came in this month, 3rd February 2025. In this month, today is the 15th. Sorry, this is 3rd February 2026. This is a printing mistake. 3rd February 2026. So she brought me, I had with the ultrasound report, but I had advised her to go for ultrasound report in 7th week of gestation. So she went with that, and along with the thyroid TSH report. Thyroid stimulating hormone was 2.06, and she brought me, this is the report, this is the early pregnancy scan report. She brought me, and the comments was there is a single viable intrauterine pregnancy. The pregnancy has been redated from the CRL of today's scan. So single viable intrauterine pregnancy they had indicated. So this is the report. We can mark. So single live viable fetus was there, viable pregnancy, but she will confirm again in the 12th week. By 13th week, at that time, really she had constipation, hard stool. In 3rd February 2026, hard stool, small external piles, sore, tender, and too much pain, severe pain she had, and aggravation after warm seas bath. So when she took some doctor advised her to seize bath and to get rid of pain. When she took the warm seize bath, she got severe pain. So after that, she came to me, and the piles mass was very, very tender. Okay. So again, I went with the modalities, that is aggravation from warm seize bath, severe pain, that is chamomilla 1 m. 1 dose, again I gave with the fractional doses, 4 hourly, the water doses. So 4 hourly 1 teaspoonful, and followed by the constitutional remedy, that is the carcinocin 10 m. again with 100 ml fractional 1 teaspoonful once daily, along with alfalfa mother tincture. And folic acid also, I had advised her the natural folic acid like spinach, all the leafy green vegetables, all those things she is continuing in much quantity. Along with that, also I advised her to for the consciousness, be a conscious mother. You have to inspire you have to lighten up your inner consciousness to develop to a baby, a very good baby, both physically and mentally. Always I say, I have seen in my practice that when I am continuing near about into 3000 cases, I can say, when I am continuing with the constitutional remedy throughout pregnancy, along with the other acute complaint, when there is an acute complaint, where we have to give other medicines to get relief of those acute complaints, adding that, and iron, calcium, protein, all those things. So whatever is needed, along with the regular antenatal checkup, I go in my clinics, along with the regular ultrasonographies and the double marker, quadruple marker, and nowadays that has come up, the genetic study like that. So along with all these things, but I continue the constitutional remedy in the diluted doses throughout pregnancy, and that I have marked the that have helped the baby to be physically and mentally very active, agile, and very healthy. So, and the pregnancy also continues very well, very in a healthy manner. So that's why I am continuing carcinosine 10 here along with alfalfa and chamomilla 1M. Today only uh, uh, I talked to her and she got relief very much after that within 2 days like that with the chamomilla 1M. And so now she is enjoying her pregnancy and she is very happy to have the baby. So if we will have a look towards the hyperprolactinemia, already we had discussed. For the carcinosine, so the mathematica of the carcinosine, what we find, that is the carcinosine usually we find the babies and in the childhood age they have a history of excessive parental control. I have found in many more carcinosine cases this symptom is very much means observable, that this symptom is present in many more cases. I have found in carcinosine cases specifically, and pressure on or an excessive sense of duty. They have a excessive sense of duty, and the parental pressure or the teacher pressure, or somehow in their childhood they are very much preoccupied with those things. In the young age also they are very much occupied with that pressure. And here also I find in this case, in this girl, as his parents are very much disciplined, she was very much under pressure, and during her school days and her college days, and that's why she developed an excessive sense of duty, very committed girl. And young persons takes life too seriously. Here also we find this complaints from anticipation, but this symptom was not present in this case. High degree of commitment, already I had told you in this case, I depend on this I depend for the fastidiousness, for the high degree of commitment and seriousness, and they are very much self-loving and very revolutionary. When they become young, when they become independent, they become very revolutionary against uh, the social factors, all those things like that. And in patients whose life has been one long hard struggle also, we find in carcinosine, or where there is a background of a prolonged fear and unhappiness. Okay. as if all grief and suffering of the world were piled upon or concentrated in this one individual. Really, basing upon this symptom, I have treated many more cases in carcinocin, not only infertility, but the cancer, but the very difficult cases in cases of the paralysis, in case of spondylosis. I got very good result basing upon this symptom that the patient says as if all grief and suffering of the world were piled upon or concentrated in this with me when it says. So this is a very good symptom we find in case of carcinocin. Then pugnacious and independent from youth, rebellious as a teenager and young adult, because in childhood he was very much suppressed. That's why he becomes very rebellious in later age. And TD to degree to a in some cases also, as I told you, perfection is very clean everything. But sometimes also we find the TD to a degree, his office desk and attire are always impeccable and has a forceful personality, definitely. Loving to tell others what to do and to push them around. They are very good inspirers, very good motivators, carcinocin. So, anxiety about business, also critical, demanding, and impatient, physically extremely sensitive to both heat and cold, twitching of eyelids as well as in other muscle groups, alternating symptoms from one side of the body to the other also we find, just like alternating symptoms from side to side, shifting, especially in rheumatism cases when the mental symptoms match the forceful personality, the fastidiousness, the committed personality. So in those cases specifically, in shifting rheumatism also, I got very good results in with carcinocin. Ongoing conflict between conscience and convention has been found in this carcinocin. Ongoing conflict, conscience, ये करना चाहिए, I have to do this, and but this social affairs is going on. Everyone is doing this, but I want to change it. I have to change it. So this is also a continuous conflict within going on inside the carcinocin. Carcinocin sensitivities to the seaside are to be reprimanded to music and sensitive, sympathetic to others' problems also. So this is more or less about carcinocin. Time is now really. Time will not permit us for second case. In second case is a very good case of a cancer, palliative care of cancer with carcinocin. In next session, I will go through 2 cancer cases with carcinocin. So thank you everyone. And any question, please?
Yes, thank you, Dr. SUMANA KUMARI PANDA, ma'am. It's really a very good session. The case itself shows the beauty of homeopathy because nobody never think of carcinosin in those conditions. But the case taking, your intense uh, knowledge in case taking is the reason behind finding such a rubrics here. And as a result, you are able to find carcinosin as the medicine for the particular patient. Lower AMH level is really very difficult to bring back to fertility because though we have seen a lot of patients coming after treatment from the other school of medicine, but they were finding it very difficult to manage. In those conditions, some of our doctors were able to bring back it to the normal and have a child to the family. That's because of the grace of God. That's what the power of homeopathy.
Exactly, sir. In
Yes.
AMH anti-Mullerian hormone 0.36. This is my first case, and I was not also thinking that I can bring happiness in the face of the
Yes,
patient.
yes, I am inviting Dr. Jolie, she is also an expert in this field. Dr. Jolie, you can say something on that. Because you are a co-host, you can directly unmute and please unmute. Yes.
Thanks, Dr. Danish, and that our beloved doctor. Now, as Dr. Danish told, AMH is very difficult to bring rise to normal if the AMH is or when getting low. But the AMH is an important hormone in determination of sex in intrauterine life. If very low AMH, can you hear me, sir?
Yes, yes,
Yes,
yes.
yes.
If in very low AMH, it is a male boy, male child, and if it is more than 5, it is a female child. So the determination of sex AMH is very important, and as our madam told, congratulates madam for that rising AMH. It is very low in PCOD also. Is not, sir?
No,
PCOS.
it is more, madam. It is increased. AMH is more than 4 in PCOD.
Okay.
More than 4, it indicates the high follicles, high number of follicles inside the ovary.
But in infertility, AMH is always low.
No,
That is
no,
pathological
madam.
condition. Pathological condition.
Uh,
Pathology.
in
AMH is low. Is it
PCOD
not, madam?
also infertility where the AMH is very high, greater than 4. And infertility also in a low ovarian reserve, that is AMH when less than 1, it is very difficult, and 1.5 it is very difficult for fertility, infertility, and a more than 4 also contributes to PCOD, and that also contributes to infertility.
Yes,
So
madam. That low AMH you made it rise
Yes.
to high, and the patient conceived. Is it not?
yes.
So congratulates, madam.
Thank you, madam. Thank you.
With calcinocin and madorinum. Thanks, Dr. Danesh, sir, also.
Okay, thank you, Dr. Jolie. And now I am inviting Dr. Amberesh sir to say a few words, and then you can say vote of thanks to the session also.
Thank you, Dr. Dhanesh ji. Everyone, Namaskar, congratulations, हमारे सुमाना कुमारी पांडा मैडम.
Thank you.
Very nice, beautiful. Describe the no-salt remedy carcinocin. Very important remedy, carcinocin. Any types of disease is the obstruction, and treat cure the patient. Carcinocin is a very good remedy. So, behalf of IFPH whole team, thanks and congratulations. Again, presentation. Dr. Madam, regular presentation, IFPH. Madam is a dynamic personality, IFPH, and important and important presentation, IFPH webinar. So very thanks, Madam. Thank you.
Thank you. That's your highness. And thanks to our IFPH.
Thank you, Dr.
And organizers.
Thank you, Dr. Amberesh sir, and thank you, Dr. Sumana Kumari Panda. And definitely we have the second session coming on March within few days. So that, but the one thing I would like to remember all of you that we are about to celebrate the 2000 day here at Zoom on coming Saturday and Sunday. And Saturday we have some national critics over here, and from on Sunday we got our beloved National President of National Council of Homeopathy, Dr. Jain, and so we'll be inaugurating the session in the on the 2001 day. That is 2001st day of our Zoom session. Tomorrow we will have a session from Dr. Jolie P.S. And she will be talking about thyroid and homeopathic management. Thank you all. And thank you all the participants once again. Thank you all. It's over to Dr. P. Shaila to moderate the Malayalam session.
Sorry. Thank you, Dr. Dhanesh. Thank you, Dr. Sumana Kumari. In a gap, we will see together. Your presentation is very nice. Always your presentation is nice. Well described about carcinocin. Thank you.
Thank you, madam. Thank you.
Thank you.